Chris Lloyd, I'm A&E consultant here at Queen Elizabeth. 18 months ago we were a very different department. At the time we were bursting at the seams. We had no observation ward, we had limited ability to manage major patients. We had 3 bays off the main thoroughfare and a resource area. Very, very cramped, very, very limited. Patient privacy and dignity was compromised. We had eliminated patients waiting in the corridor, which was a great move prior to that point, but we were still at risk because of capacity. We had a very small paediatric area, which was a good stepping stone, but it was severely compromised on space again, and to the point that actually we had to limit the paediatric area to under 10s because of the physical space that children and their families would take in terms of the waiting areas and the clinical assessment areas. It was a really difficult environment to work in, and even when the actual number of patients in the department wasn't high, it always felt busy. We've had the £2 million investment in the modular build that we're sat in at the moment, which has given us a 4-bedded observation ward. We've got additional 4 major cubicles, so we've now got 12 major beds, which includes the 4 resource beds, all of which have got high fidelity monitoring. Resource in particular, there's a lot of work going into redesigning the stocking of resource. So, for example, for major trauma, we've got a large cupboard laid out, everything's in drawers, whether it's chest drains, arterial lines, airway kits, splinter devices. It's all labelled, it's all ready, so that it's in grab reach effectively. This is a room off the main corridor towards the end of the department, where bereaved families can go and spend some time with their nearest and dearest in their worst hours. These families can be managed in a very private area. It's quiet for them, they're not exposed to the hustle and bustle of the rest of the department. They can spend as much time as they want with their loved ones. They've got telephone access to the coordinator. The housekeeper does a great job in keeping the place stocked with biscuits and tea. Done a lot of work with the trauma network to try and improve our trauma care, and we are delivering high quality trauma care.